Hello everyone and welcome to the Student Sustainability Research Conference 2021. My name is Jane Frances Chinelo Ofomata. I am a postgraduate student on the MPH Public Health International at the University of Leeds. The topic of my presentation is the effectiveness of a peer-based approach in improving HIV self-testing among female sex workers in Delta State, Nigeria. Here are the outlines. We're looking at the background of the study, the aim and objectives, the method, data collection and analysis, expected outcomes, and the references. Female sex workers are one of the key populations who are being targeted for HIV interventions. In sub-Saharan Africa, they are at more risk of HIV infection due to the kind of work they do, and the risk is more than that of other women of reproductive age. Several barriers inhibit the ability to access care or access HIV service, which include stigma and discrimination, especially from healthcare providers when they disclose their source of livelihood, inconvenient location, and opening times of health facilities. Because they have to work throughout the day and sometimes throughout the night, they are not able to visit the health facilities to queue up for care, especially where there are no targeted interventions or targeted services for this population. Because of the high risk of HIV infection faced by female sex workers, the World Health Organization recommends quarterly HIV self-testing by female sex workers, meaning they have to test every 3 months for HIV infection. Unfortunately, many female sex workers in sub-Saharan Africa have not met this standard because them having to test every 3 months means they have to be visiting the health facilities every 3 months. And this may not be acceptable or appropriate for them. HIV self-testing therefore surmounts these barriers by allowing them to test at the comfort of their homes. This self-testing involves rubbing a swab around the gums and dipping in a reaction solution, which within 20 minutes detects antibodies to the HIV virus in the saliva. Therefore, this is a really convenient, reliable, and acceptable method that allows individuals, especially vulnerable groups such as the female sex workers, to get tested at the comfort of their homes and with the much needed privacy. There's a growing evidence of the effectiveness of a peer network-based approach in increasing uptake of HIV self-test among key populations. This means that prominent or more experienced female sex workers will be recruited and used as a way of delivering the HIV self-test to their fellow female sex workers. And this strategy is always more effective when motivated, when assisted with incentives. This delivery strategy, therefore, allows the other female sex workers to get tested as frequently as they should. In addition to improving case finding for linkage to antiretroviral care, this strategy would also contribute to achieving the ambitious 95-95 target set by the Joint Committee on AIDS for HIV detection, treatment, and prevention. This 95-95-95 target means that by 2030, 95% of people who live with HIV know their status, 95% of those who know their status are on treatment, while the other 95% of those who are on treatment have achieved viral suppression. Because we're interested in achieving the Sustainable Development Goal 3, which is good health and well-being for all, and also achieving the 95-95-95 target for HIV, this study aims to determine if a peer-based approach should be an effective service delivery strategy to improve HIV self-testing among female sex workers in Delta State, Nigeria. The objectives of this study are: 1. To assess HIV self-test use among female sex workers, to assess how willing they are to seek HIV-related medical care in the event that a test turns out positive, and the third one is to assess the willingness to pay for the HIV self-test and the cost benefits of the intervention. Generally, HIV testing in health facilities is free, But for the self-test kits, they are not free. Now, the female sex workers need to be tested every 3 months. So it won't be ideal for them because of the kind of job they do and the stigma around their work. It won't be ideal or convenient or acceptable or appropriate to them to visit health facilities every 3 months. So they will need to have these self-test kits and use them every 3 months as required. So we'll be assessing how willing they are to pay for this self-test kits and the maximum amount they can pay for them. And then through this, we'll also be assessing the cost benefit of the intervention. That's if the cost of the self-test kit and the benefit ratio, if the benefit outweighs the cost of the self-test kit, then this intervention is worth investigating as a social franchise scheme, where we would give the HIV self-test kits to the peers that the female sex workers will be working with. We'll give it to them as a reduced rate for them to sell to their fellow female sex workers, and then make some income from it, as well as empowering the other female sex workers to always be getting tested as required. For the methods, we'll first of all be obtaining an ethical approval from the Institutional Review Board of the Ethics Committee of Delta State University, Nigeria. The study will be conducted in Asaba, a city in Delta State, Nigeria. The city now has a proliferating number of female sex workers, probably due to socio-economic status of the state, because it's one of the oil-producing states in the country. The study will be a prospective cohort study and would involve a 4-stage preparatory process. The first stage will be about interviewing the secondary key informants, who include the commercial bus drivers, the hotel and bar staff, security staff, law enforcement agencies. We're using these key informants because they are more likely to have obtained services from the female sex workers. So they are more likely to know or to be able to identify and describe the hotspots where the female sex workers work for, seek for, and meet clients. We'll also be gathering information from these key informants about prominent or experienced female sex workers. We know it's a difficult, it's a sensitive issue, and it might be difficult to obtain this information. We're going to use the best strategies possible. The second stage would involve the selection of female sex workers from the links that have already been provided by the informants. These female sex workers will now serve as peer mobilizers that will help us to recruit other female sex workers. The third stage involves a 2-day training of the peer mobilizers on the use of the oral HIV self-test kits, results interpretation, and linkage to treatment. The linkage enhancing intervention would be a dedicated toll-free hotline staffed by a sexual health worker. This hotline will enable anyone who has any study-related concerns to be able to call the researchers, to be able to pass information between the researchers and the participants. The fourth stage, that's the last stage, involves the recruitment of the rest of the female sex workers by the peer mobilizers who they already know, to ensure trust, because HIV self-testing is a relatively new intervention and might instill fear among users. The recruited female sex workers will then be referred to the research team for eligibility assessment and enrollment. The informed consent form will be signed by every participant of the study in their clear state of mind and not under the influence of drugs or alcohol. The inclusion criteria for recruitment into the study for the peer mobilizers would be that they must be 18 years or older. They must have been working as female sex worker in Asaba and 8 environs, and must fit into the definition of a female sex worker, who is defined as any female who receives money or other valuables or gifts or incentives from a man in exchange for sex in areas like bars, nightclubs, hotels, brothels, and even on the streets. Must be respected and trusted within the female sex worker community as determined by the key informants. There will not be any educational requirements, and they do not need to have been tested for HIV within the last 3 months before being enrolled. For the other female sex workers who will be recruited by these peer mobilizers, they need to be 18 years or older. They must be female sex workers resident in Asaba and its environs, and must have been working as a female sex worker in Asaba and its environs for at least 1 month prior to being enrolled into the study. They must not have tested for HIV within the last 3 months and must not have used the oral self-test kits before. For the distribution of the self-test kits, the peer mobilizers will be scheduled to visit participants 3 times over the duration of the study to distribute 2 self-test kits each per person, the second one for retesting after 3 months if the first test was negative, and to encourage them to call the hotline if they tested positive or for other study-related concerns. These visits will be done independently. However, the researchers will supervise the peer mobilizers. The visits will be done at 2 weeks, at 6 weeks, and at 3 months. Up to 10 peer mobilizers will be expected and will be given incentives. Data will be collected using a baseline cross-sectional study questionnaire administered before the intervention to obtain a demographic characteristics of the participants and previous history of HIV testing. This will give us information as to whether the HIV self-testing through the delivery models of using the peer mobilizers have been effective in improving testing among the female sex workers. Then a willingness to pay questionnaire would also be administered to get the maximum amount they can pay if they were to buy these HIV self-test kits. In a qualitative study will be done using a focus group discussion with the peer mobilizers to evaluate the barriers and facilitators of the delivery model. Data will be analyzed using a descriptive analysis of demographic characteristics and the testing rates of the study participants. Then for the qualitative study, a thematic content analysis of the focus group discussion responses will be done. The cost-benefit analysis will then be used for the willingness to pay data. At the end of this study, we're expecting several outcomes. The primary outcome we'll be expecting would be any HIV testing, any HIV self-testing following the peer mobilizers visits, and these will be measured at the 1st month and at the 4th month. The secondary outcomes are improved use of HIV self-test kits amongst the female sex workers, increased willingness to seek HIV-related medical care, treatment, and initiation following a positive test result, higher retest rates 3 months after a negative result, and increased willingness to pay for the HIV self-test. These outcomes will therefore contribute to achieving the SDG 3, good health and well-being for all, as well as achieving the SDG 10, which is to reduce inequalities faced by female sex workers in accessing HIV-related care. Here are a few references. Thank you very much for listening. I hope you enjoyed my session.